when you're looking for the diagnosis of, Zika virus and monoinfection, the prolonged RNA, shedding, maybe it's not seen in everybody, and our, diagnostic tools have some certain limitations. We are seeing, prolonged RNA sheddings because we actually used a different, study design, and we got, serial samples. But when you're taking a look during epidemic, times are really tough, because if you are a physician and you're doing, assistance to the patients, most probably you're gonna get, one sample at the time that the patient actually shows up at the, clinics or at the hospital, and you're gonna see that, it's basically that sample, and sometimes you can see that depending on the time of the infection, your tool will be, less sensitive to actually detect, positivity in a patient, even if, he or she develops symptoms. For the prolonged RNA shedding, you must have, a good test in the beginning. This study, showed that, but this was, unproposed for individuals who were recruited very early in their disease development, and so they could be followed up, and so we could have a group that we could use, the same test in different samples and during a long time. But it is not, the real world, when you are there taking care of the patients, when they are showing up, with disease. And this is an overwhelming work, so it's not gonna happen. That's the first, actually thing that might interfere with the detection. Second, we know that the tests are completely different in terms of sensitivity, specificity, and when you don't have, actually your diagnosis based on molecular tests, you try to do that with, immunological tests. But, in this conference, as in the, actually in the, let me tell you this, in the whole, scientific, field, they are seeing the same thing. Diagnostic tests are limited, and they actually show different results depending on the population that you're examining. For instance, if you take a look on European travelers, I'm going to Thailand, I'm going to stay, having a sunbathing, it's someone different from, from Brazil, the guy who is actually at home, or, the people who are living in the place. Endemic regions, are not, the same thing that non-endemic regions. So the tests show that, because they can see, the infections the same way in the different groups. So that's another problem, to actually detect this in an accurate way, or, and this is one of the limitations. For you have to actually, in this conference, actually, they are trying to looking for, a best test, and produce something, a tool that's more accurate. In our group, we have, exactly a laboratory that's, at this very moment, they are looking for, accurate tests to address exactly the questions about, how to improve the diagnosis, how to, make diagnosis in late periods, so we can see, individuals not only that, persist with your infection for a longer time, but also, to capture, and rescue the results in people who did not have this diagnosis very early, and you can do that later, especially if you have other conditions that might interfere, and maybe producing disease, like, as we mentioned before, if you have immunosuppression, if you don't have your accurate diagnosis early in your disease, can I have this later on? So this is a problem, especially when you're trying to decide, which drug you are gonna use. In this very moment, we're having one patient that's exactly in this kind of dilemma. We have, Zika virus, being, proliferating, replicating in his serum and his urine, and he has, RNA detectable for like 8 months, and he comes and go to the hospital, getting better a little bit, and then he comes back again, and he didn't improve very much, and now he's really suffering a lot because he's not getting better from his, disease, and he has, really high morbidity, and we really don't know if you can, make anything better for him, especially because he does have to go through an immunosuppressive therapy right now to control his actually basic disease, and that's a big dilemma. So recovering the diagnosis and getting, a good, tool to, getting the very first beginning of the infection, but later on it's important. So any effort, to well diagnose the individuals, as well as doing, public health, investigations, and using tools that you can actually have, a real, data or information in the population affected by Zika or other virus is also important. So that's it.